قالوا سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم. Now, central venous pressure, everybody is putting the central venous lines into the patients who require it, particularly in critical care medicine, or the patient going for the major surgery, they always put a central venous catheter. And in the books, written a big list of indication, this and that. But the important thing is, even if you train the junior most person, or even if you treat the sweeper and ward boy how to put the central line, they can put it, because it's a technical thing. The important thing is how to interpret. If you are measuring central venous pressure, how would you interpret it? That's important, because that is the job of doctor or a consultant or specialist to analyze it, that what does the central venous pressure tell you. So I'm quickly going to go through this in 4 or 5 minutes. Now, what is the central venous pressure? It is the central venous pressure is the pressure in the central vein. And what is central vein? Vein which is subjected to positive and negative pressure of breathing. It means it has to be in the intrathoracic region. If got central venous catheter through the femoral vein and in the abdominal cavity, that does not tell you central pressure, central venous pressure, until unless the tip of the catheter is in the thorax. So it's commonly used is a superior vena cava or inferior vena cava, provided the tip of the catheter is in the thorax. Now, what are the physiological bases of central venous pressure? There are two things on which the central venous pressure depends. One is blood brought to the heart. How much is the blood being brought to the heart? That depends on two things: total blood volume and tone of the blood vessels. If the vessels are constricted, they push the blood to the inferior vena cava, and that is delivered to the heart. It means it will increase the preload. Now, if the vessels are dilated, so the blood will be accumulated over there, and there will be less preload and less venous return. That will affect the central venous pressure. And it also depends on the total blood volume. If the patient is already hypovolemic, absolute hypovolemia, so that will affect the central venous pressure also. Second thing is the myocardial contractility. Now, this blood volume is delivered to the myocardium. How good is the myocardium to deal with it? If the myocardium is diseased or depressed, it cannot deal with it. It will increase the central venous pressure. So there will be backlog. It will be accumulated, right? So these three, it means there are three factors: total blood volume, number one; number two, tone of blood vessel; number three is the myocardial contractility. So we have to analyze these three factors. Now, sites usually put in the jugular vein, internal jugular, subclavian vein, femoral vein, cephalic vein. These are commonly used. Right. Now, there can be three possibilities of central venous pressure. Central venous pressure normal, central venous pressure low, central venous pressure high. क्या और हो सकती है पॉसिबिलिटी? तीन ही हो सकती है ना. Now, normally, when you say the central venous pressure is normal, so then you will have to look at the blood pressure, you have to look at the heart rate, you will have to look at the peripheral temperature. If the blood pressure is normal, heart rate is normal, and periphery is warm, then the central venous pressure which is indicated is normal. If the central venous pressure is within the normal range and the blood pressure is normal, heart rate is normal, and periphery is warm, it means it is a normal central venous pressure. Now, if the central venous pressure is low, there is no other cause. You don't have to look at anything else. If the CVP is low, there is no other cause but hypovolemia. Could be relative hypovolemia, could be absolute hypovolemia. Relative means you have increased the capacity, vasodilatation, but the blood volume is normal, so it is relatively hypovolemia. Or otherwise, if the patient is losing blood, patient is losing the water, electrolytes or other thing, so that is absolute reduction of blood volume. So what would you do? Fill the vessel. Fill the vessel with the fluids. And you fill the vessel with the fluid which has got cold osmotic activity, because it will remain in the vessel. It will not immediately go. So it means you will give cholate or cholate substitute. If the hemoglobin is low, you give blood. You give plasma, plasma substitute, synthetic, Hemaxil. So there are so many choices you can use that, right? So fill the vessel. If the CP is high, so there are three causes. Either it is hypervolemia, or there is increased tone of the blood vessels, or there is a decreased myocardial contractility. Those three physiological factors on which the central venous pressure depends. If the hypervolemia, blood pressure might be normal, heart rate might be normal, but the periphery is warm. And gradually, the blood pressure shoots up, heart rate might go down or might go up, so that is hypervolemia. If the patient is hypervolemic, you stop giving fluids, give diuretics, get rid of fluids. So that will lower the central venous pressure. Now, second possibility, if the blood pressure is normal and there is heart rate is increased and periphery is cold, that shows increased tone of blood vessel. There is vasoconstriction. They are pushing the blood to the heart, but because of vasoconstriction, blood is not going into the vessels. So vessels are constricted and they are becoming cold. So there are two causes of this increased tone of blood vessel. In post-operative period, the patient has got a pain. Give analgesic, you will see immediately the central venous pressure starts coming down. Now second is, somehow or other in a post-operative operation, surgeon has stimulated the sympathetic system. Doing gallbladder surgery, they have just manipulated the celiac plexus. So their blood pressure shoots up. Due to blood pressure shoot up, the catecholamines increase, they cause vasoconstriction, they will increase the preload and the central venous pressure goes up. So if with giving analgesic, the central venous pressure doesn't come, then you give vasodilator to the patient and hypotensive agents. So you can drop the central venous pressure. The third possibility is decreased myocardial contractility. Blood pressure will be low, heart rate will be increased, periphery will be cold. It means heart is not able to, the preload to be put into the vessels. So it means you have to stop the fluid which you are giving, then at the same time strengthen the myocardium. You give inotropic agent, vasoconstrictor, dobutamine, or such drugs you will give will strengthen the myocardium. So you will see immediately the central venous pressure is coming down, blood pressure is increasing up, and periphery is warming. So this is how we interpret. First is the normal, second is a high, low, and the third is high. For high, there are three causes. One is hypervolemia, and second is increased tone of blood vessel, third is decreased myocardial contractility. This is central venous pressure, nothing else. Again, central venous pressure is a relative figure which you are given. First time when you look at central venous pressure, that is a reference point for you. Every time you look at, compare with the one, it is going up or going down. This is not an absolute level. It is a relative figure. So this is a very useful parameter to be monitored in a patient who has got a heart disease or being given fluids.